I'm Brittany Lewis with Forbes Breaking News. During Tuesday's Senate Appropriations Committee hearing, Senator Tammy Baldwin asked public health officials about the substance use epidemic. The senator raised concerns about synthetic opioids such as fentanyl. She also spoke about the importance of investing in research into substance use disorders to, quote, prevent deaths, treat patients, and make our community safer. Here's more from the Wisconsin Democrat.
Senator Baldwin.
Thank you, Madam Chair. Welcome, Dr. Tabak. I am posing the first question to you for an update on research efforts to better respond to the substance use epidemic. By way of context, as you well know, the substance use epidemic continues to ravage communities across Wisconsin and across the United States. Okay. And an increasingly dangerous role is played by synthetic opioids such as fentanyl, as well as psychostimulants like methamphetamine. So I believe it's vital that we invest in sustained research into substance use disorders to prevent deaths, treat patients, and make our communities safer. If you could describe recent research efforts, including what's happening with the HEAL initiative, the Helping to End Addiction Long-Term initiative, I would appreciate that.
If I may, to turn to Dr. Volkoff, who is our expert in this field.
Absolutely.
Thanks very much for the question. And the research is actually going from the basic to help develop medications with new targets, to help develop formulations that can be actually lead to better outcomes, to epidemiology research to understand the changing face of the overdose crisis, which now, as you are mentioning, is no longer just limited by overdoses from prescription opioids, but encompasses overdoses from fentanyl, methamphetamine, and cocaine, to implementation research that can help us determine what are the optimal models of care that we can deploy in community and that take advantage of infrastructure. So, for example, research is ongoing to determine how the healthcare system can be involved in the prevention and treatment of substance use disorders. How can we bring treatments to justice settings like prisons and jails and upon release and maximize the feasibility of these individuals to get healthcare, to the involvement of communities so that we can actually integrate the effort between healthcare, justice, and communities. Through the HEAL initiative, we have been able to accelerate significantly. Also, another area that has been neglected overall, which is the need to better treatments for the management of severe pain. And if we do not address the need of patients suffering from severe pain, we may keep them as being very, very vulnerable to seeking out much more dangerous drugs out in the illicit market. And finally, we need to also ask ourselves, what is it in the United States that is making Americans so vulnerable to the use of these drugs? And that is very relevant to prevention, because if we do not understand it, then we cannot do interventions to actually protect those that, because of circumstances alien to them, are actually at much higher risk of taking drugs and ultimately develop addiction or overdosing.
Appreciate your response. Dr. Fauci, the U.S. was able to bring a COVID-19 vaccine to the public in really record time. And I'm grateful for the work of so many that made that possible, including several who are in this room. Unfortunately, the next pandemic, driven by an unknown disease X, will come. And I believe we can't wait. We should invest in the development of novel antivirals and vaccines and diagnostics for unknown threats from priority viral families now, so that we're better prepared in the future. Can you explain how the investments we've made over time at NIH, and across the federal government made the COVID-19 vaccines and medical countermeasures possible? And how would sustained investments to develop responses to viral families of concern make us better prepared?
Right. Thank you very much for that question, Senator. Yes, it's very, very clear that the investment in basic and clinical biomedical research for at least a few decades and maybe more prior to the realization that we were dealing with a new historic pandemic, allowed us to do something that was completely unprecedented. Two examples of that are the work that was done on what we call vaccine platforms, the mRNA vaccine, which was fundamental basic research on how to get the mRNA molecule to actually serve as a platform for vaccine. Work at the NIH in our own campus, as well as NIH-funded investigators throughout the world, also worked on what's called immunogen design to do work that led to the ability to stabilize the optimal immunogen. In this case, it was the spike protein, which allowed us to go from realization of a new pathogen on January 9th, 10th, 2020, getting into phase 1 trial in 65 days and 11 months data, having a safe and effective vaccine. We did that because of the investment you're referring to. Right now, looking forward, we have what's called a prototype pandemic preparedness plan, which means you do just what I believe you're alluding to. You develop a number of families. There are about 20 families that are the high risk. Of those, there are about 7 families of viruses that if you do the fundamental work of looking at the commonalities among them and develop diagnostic tests, assays, immune correlates, and do that now. And if we don't get the resources now, Congress has been very generous to us up to now, but if we don't get the resources we need, we're not going to be able to do the kind of preparedness, not only for vaccine, but also for targeted development of antivirals, which we did so successfully with HIV and did quite successfully right now, but we have programs that are not going to get off the ground unless we get funding. So fundamental, basic, and clinical research are the core of everything that's going to protect us in the future. Thank you.
Senator Braun.
Thank you, Madam Chair. So I'm going to have two